Hello and welcome to the Power Tools Coalition's webinars series. I'm Kinkini Banerjee, the Coalition Relations Director at USBC, and I'm so glad you've joined us for this session. The Power Tools series is for both our network of coalitions as well as our network of national organizations and community-based organizations and any advocate who is working in the field of birth and breastfeeding. The access is free and open to anyone, and we really do focus on policy systems and environmental transformations in the first food field. So if you're here, if you're looking to see how you can collaborate, how you can build a coalition, how you can evaluate your progress, how you can write grants, this is the place for you to come in and see what others are doing in the field. The webinar announcement emails are sent through the USBC's announcement list, and to streamline access, these have been set up as once you've registered for the session, you are automatically registered for each of our sessions in the series, and you'll get a reminder email. So the topic and speaker details are posted 1 to 2 weeks before each session. And if you want to see the details, we have a number of webinar series. For this one, you can go to www.usbreastfeeding.org/power-tools. The session details are also posted in the Coalition's Learning Connection as well. And you'll be able to download the slides. You can see in the chat box, you have the link to the page, and you'll be able to access all of the slides for not just for today, but also from our archives of previous sessions. Each of these sessions are recorded. We know that it's hard for folks to make time in the middle of their workday, so we know that many of our registered attendees access the sessions later on at a time convenient to you. So do keep that when in your email post-event email that you get, you will also get the link for where the archives are. So we hope, we thank you for being here, and please be sure to complete the evaluation and let us know how these sessions go. We also ask for your suggestions in the evaluation. So this is your ideas and your suggestions are what we bring to this learning collaborative. We also, for those who complete the evaluation, you get a certificate of attendance. So be sure to send us your feedback and also collect the certificate of attendance. As I said, the slides and resources for this session and our archives of past sessions are in the Power Tools page. And if you go to if you don't have a direct link to it, if you go to our website, look at the tabs across the top, and the one that says webinar, click on it, and it'll open up a drop-down menu. So click on the Power Tools series and you'll be able to access today's slides. Because we have a large number of attendees, we have our attendees in listen-only mode, but we do want to make sure that we have this session as interactive as possible. We will have about 20 minutes for dedicated Q&A at the end of the presentations, but please share your insights, questions, comments throughout the session using the question box. So you can type your questions at any time, and here's how you do it. You should see a control panel on the right of your screen. If you don't see it, it might be minimized. So click on that orange tab with the white arrow and it'll pop the control panel out. Under the audio tab, you'll see a tab which says questions. Click on that and it'll open up a text box for you to type in. And we'll be, Miriam, our coalition's relations coordinators, here with me as well, and we will be checking the questions box as well as the comment sections throughout the session. So we will be on hand to answer your questions. But if you have audio questions or any other and can't access the chat box to let us know, please email coalitions@usbreastfeeding.org and one of our staff members will be happy to help you. And that brings me to today's topic, advancing inclusive and equitable breastfeeding support at the Grassroots. We are so thrilled today to bring you three outstanding groups that really show what it is to be working in service of community. Strong, well-functioning breastfeeding coalitions serve as powerful vehicles for change by addressing the structural barriers and leveraging the community strengths and utilizing different innovative approaches to advance breastfeeding support, protection, and promotion, and more specifically close the glaring gaps in racial disparities that we see. The 2011 Surgeon General's call to action really emphasized the importance of breastfeeding coalitions and affirmed that it is really at the state and local levels that initiatives need to be implemented. So during this session, we have DC, Virginia, and Maryland breastfeeding coalitions sharing with us how they are leveraging the passion, the commitment, the expertise, the wisdom of their membership and of their communities to identify and implement broad-ranging initiatives to improve the landscape of breastfeeding. All three of these coalitions have been invited to present at the National Breastfeeding Conference and Convening that we had in June in Bethesda, Maryland. And they were prepped, they were ready to do that. And during the session, we had an outstanding session on inclusion, in inclusiveness in breastfeeding. And we had Stephanie Carroll speaking about LGBTQ families and breastfeeding support. And we had members from Reaching Our Brothers Everywhere, Robe, that did an outstanding presentation of how parents, fathers, are such an important part of our work when we have to in breastfeeding. And that was an outstanding panel, and all of our three coalitions here really generously gave their time so that the audience could continue to hear from that panel. So we are glad to be able to give this forum to them to share today. I am thrilled. So Maryland Coalition will describe how it's intentionally engaging its network of membership and of moms, educators, policymakers to address the complex issues that the state is facing and how they're bringing sectors together and really looking at how Maryland is listening and exploring its role as a backbone support organization for its network of county and other local coalitions. The Virginia Breastfeeding Coalition will describe its process of stretching resources to explore and develop breastfeeding promotion and support strategies, which are aligned with their regional and national prevention plans and geared towards communities with the greatest unmet needs. So they will also be sharing a little bit about some of the legislation as well as a pilot project that they will be embarking on soon. And then DC Breastfeeding Coalition will be sharing about how it's leading and participating in both, multi-sector, multi-strategy efforts to advance equity in breastfeeding support. So DC Breastfeeding Coalition will be discussing many of the integrated strategies, how they sustain them, how they optimize efficiency, and how their aligned activities are so explicitly focused on advancing equity. So I'm delighted to introduce our presenters. Our first panelist is Uranus Ray Mapson. She's from the Southern Maryland Breastfeeding Alliance and will be speaking on and sharing about the Maryland Breastfeeding Coalition. Ray is on the Maryland Breastfeeding Coalition Board of Directors. She works as the senior peer counselor for the Southern Maryland WIC program, and she's a community health outreach worker for the Charles County Health Department in Maryland. In addition to her involvement with the coalition, Ray is a member of the National Association of Professional and Peer Lactation Supporters of Color, or NAPLC, the National WIC Association. She's the chair of family engagement of the Charles County Early Childhood Advisory Council, and also serves on the Judy Center Steering Committee Partnerships for Healthier Charles County and Babies Born Healthy Community Support Group. So as you can see, with the hats that she wears in her county at the state and national level, Ray brings just so many advantages. She's a breastfeeding mother of 3. And she lives in Southern Maryland and enjoys spending time with her family, cooking, planning, and organizing events. So thank you, Ray, for all the work that you do in the community, and we are so thrilled to have you with us today. Our next presenters, and I'm going to introduce all of the presenters, and then they will be, we'll first start with Maryland, and then we have Virginia that's going to present. And we are absolutely thrilled to have 2 presenters from Virginia, our power twins here, Jareen Fleming, who is the state breastfeeding coordinator with the Virginia Department of Health, and Angela Love-Saranka, who's the chair of the Virginia Breastfeeding Coalition. Jareen joined the Virginia Department of Health from the University of Miami. She provided direct client services, conducted research, developed breastfeeding curricula, and spearheaded their community engagement and outreach. Jareen is an IBCLC, a certified lactation counselor, a La Leche League leader, and prior to working with the State Health and Human Services, Jareen had an extensive career in media and worked on a wide range of film and television projects. Making a positive impact in the area of maternal and infant health through breastfeeding is Jareen's passion. Her particular focus is closing the racial health disparity gap by promoting breastfeeding for all families. So welcome, Jareen. Angela has been a peer support breastfeeding counselor since 1990. Angela is also a board certified lactation consultant and the chair of the Virginia Breastfeeding Coalition. And in addition to her clinical practice, which has included both in-hospital outpatients as well as private practice, Angela advocates fiercely for improved maternal child health practices at all of the local, national, and global level. She is a key contributor to the development and advancement of this profession and provides subject matter expertise. So again, welcome to Jareen and Angela. And then finally from DC, we are thrilled to have Vanessa Hannibal from the DC Breastfeeding Coalition. Vanessa is a birth and postpartum doula, and her first experience with childbirth was in 2013, helping her cousin labor until 9 centimeters before she had an unplanned C-section. Vanessa felt that the cousin was not given the time to birth her baby vaginally, and that experience taught her the importance of women having proper education, advocacy, and support to feel empowered during pregnancy and birth. Vanessa has now attended 11 births and believes that childbirth is a powerful and transformative experience. And really, her passion is helping mothers have birthing experiences that are empowering. Vanessa has a degree from the Tennessee State University in public health and is a labor postpartum doula and breastfeeding coach. She also has trained on perinatal mood disorders and anxiety and led childbirth, breastfeeding, and newborn care classes. And Jennifer will be joined, Vanessa will be joined by Dr. Jennifer Tender, who is an academic pediatrician and fierce breastfeeding advocate. Um, Jennifer has been an active board member of the DC Breastfeeding Coalition since its inception and is a breastfeeding coordinator with the DC chapter of the American Academy of Pediatrics. And she has been um, uh, part of the AAP coordinator of the DC chapter of the AAP for over 20 years. Dr. Tender is also a member of the DC Lactation Commission, and her research interests include breastfeeding education for students, residents, and addressing breastfeeding barriers that many of the WIC families face when navigating the healthcare system. And with that, we are delighted to have all three coalitions here. I'm going to turn it over to Ray to begin.
Okay. Good afternoon. Again, my name is Ray. I'm going to share some of Maryland Breastfeeding Coalition's accomplishments and projects we have either completed or are working on at the present time.
Just a second, I'm pulling this up. Can you see my screen now?
Mm-hmm.
All right, go ahead, Ray.
Okay, you ready? Okay. Good afternoon. Again, my name is Ray, and I am going to share some of Maryland Breastfeeding Coalition's accomplishments and projects we have either completed or are working on at the present time. Advance the slide. This first slide is the most recent rates for the breastfeeding per the CDC. More white women are reaching the Healthy People 2020 goal, and black women are not, especially here in Maryland. This is a true representation as to why MBC is looking through the equity lens and moving more to practice. The take home message from this would be we would all love to see the rates higher. The disparity among the women breastfeeding in Maryland is not acceptable. Therefore, MBC is continuing to commit themselves to this work. Now I will share some projects and accomplishments of us addressing these issues and concerns. MBC has been engaged in equity work for the last 5 years, following the example of and through the support of USBC. Following USBC's example, the Maryland Breastfeeding Coalition has been examining our work through an equity lens. Since 2014, MBC board members actively pursued relationships with organizations not previously represented at MBC. This includes attending Mocha Moms meetings, engaging in projects to facilitate working relationships with WIC and Baltimore Healthy Start, attending lunch and learn sessions by the executive director of Mom Cares, attending the 2018 Reimagining Black Girls and Women's Health reception, symposium and workshop at Towson University, outreach to doulas working in Baltimore City, WIC and African American Health Project program managers and peer counselors in local health departments. The Black Nurses Association of Baltimore, Howard County branch of the NAACP, the Bloom Collective in Baltimore, Mother Hugh, D.C., Maryland Department of Health, the Office of Minority Health, individual IBCLCs, and aspiring IBCLCs of color throughout our state. Attending baby and health fairs sponsored by a wide variety of groups in Maryland, including Maryland Families for Safe Birth. Some of the organizations already mentioned, as well as mosque and other faith-based organizations. By attending meetings and events with these organizations or people that represent these organizations, NBC is expanding who we are as a coalition and the number of people we can reach in Maryland. It is through these connections and building relationships with executive directors, board members, and members of these organizations that NBC was able to increase the representation of previously unrepresented populations. This increased our membership and allowed the coalition to draw on a more diverse group of individuals to bring onto our board. We actively recruited people of color to become members and to our board of directors. While our board is not yet truly representative of our state, as a whole, we are moving forward more, moving toward more equitable representation. In 2017, we drafted and adopted a diversity value statement into our bylaws. Recent outreach and a survey by NBC to various minority focused community groups in Maryland revealed a desire for breastfeeding education to better support women in their communities, including the desire to become IBCLCs. The number one barrier these women cited was the money to pay the tuition to take the college and lactation courses. The Maryland Breastfeeding Coalition is fundraising to reduce this barrier by providing financial support for women of color in Maryland, which would include a 90-hour lactation course, payment of exam fees, and mentoring by an IBCLC, which would be a member of MBC. Through financial support of their lactation education journey, we hope to eliminate one of the barriers to completing the education and training required to become an IBCLC. The Bloom Collective in Baltimore is fundraising with the goal of sponsoring 10 women of color through the 45-hour Certified Breastfeeding Specialist course. NBC collaborated with the Bloom Collective on this project, offering technical assistance, and is promoting the program widely throughout our network. Advance the slide, please. I became involved with NBC by way of the Southern Maryland Breastfeeding Alliance. I am the sole peer counselor for 5 clinics. As part of the alliance, I would hear about NBC and some of the things they were doing. Nancy, the president, reached out to me to come to an NBC meeting. I went and then decided my presence was needed, not only at the meetings, but on the board of directors. I am on the board of directors as the representative for the Southern Maryland region. I can truly say in the last couple of years, NBC has taken on a new role in our community and representing Maryland to the fullest. I am proud to say my role is just as important as everyone else who represents NBC, with a minor twist. I represent for the mothers who look like me. Advance the slide. Through our Facebook page, we were contacted by a young mother that lives in Prince George's County. She discovered as a new mom needing breastfeeding support, her nearest resources were in D.C. Through connections with IBCLCs and others in D.C., she learned about breastfeeding coalitions, and that is what prompted her to reach out to NBC. Sadly, we were not planning any events, and through our networks discovered no one else was. We reached out to this young mother, invited her to share her story, and encouraged her to join NBC. She has attended our meetings throughout the last year, has attended numerous community events for NBC, and has actively involved in planning our chocolate milk movie screening to celebrate Black Breastfeeding Week this year. She is now one of our new board members and is studying for her IBCLC certification. She also looks like me. I have served on the NBC board for the past year with Lachelle Stewart, who is the director of Healthy Start Baltimore, and wanted to share some of her thoughts on this topic. Coalition members are professionals, moms, community members, providers, not all limited to professionals. Advocacy for mothers who approach the coalition with a need, rebranding our new logo, thinking of ways to outreach via social media, a website, encouragement for new members such as myself to take on a role within the coalition. Education about conferences, trainings, etc., on the topic of breastfeeding. Breastfeeding friendly awards and signage for businesses. Seeking resources to develop more breastfeeding education professionals in the community. Strategic planning sessions and examining other successful groups for ways to grow our organization. Helping members and others understand the laws related to breastfeeding rights and supporting bills related to maternal health at the local, state, and federal level. And Lachelle is featured in several of these pictures on this slide. Other ongoing and upcoming NBC projects. These are things that we're working on, okay? Breastfeeding Welcome Here campaign. Maryland Breastfeeding Coalition launched a campaign to create a supportive environment from retailers when moms breastfeeding their babies in public. 59 businesses have signed the pledge. We had a master's degree student promoting the campaign in Southern Maryland this last spring. United States Breastfeeding Committee. Last year, NBC sent 3 people to the to the USBC convening in Atlanta, Georgia. Our delegation included 1 veteran leader and 2 emerging leaders from our board. This year, we sent more board members as the event was local. I was one of those emerging leaders that got to go last year as well. 10th Annual Maryland, D.C. Regional Breastfeeding Friendly Workplace Awards. Since 2010, over 120 businesses and healthcare providers have received the award. Maryland Breastfeeding Coalition does this in collaboration with the D.C. Breastfeeding Coalition. Supporting breastfeeding legislation. Last year, NBC members testified on behalf of family leave and lactation accommodation bills. Maryland SB 859 guarantees state employees 6 weeks of paid paternal leave. Maryland HB 306 guarantees state employees time and place to express milk at work. NBC also wrote a letter in support of lactation accommodation for employees in Baltimore City. Councilwoman Sneed proposed this legislation, which was signed by Mayor Pugh on January 14, 2019. Exploring use of human donor milk and breast pump access for NICU moms. NBC is exploring use of human donor milk and breast pump access for NICU moms throughout the state and viewing this through the equity lens. Who has access to high quality pumps and human donor milk? That is the question we ask. We are in the beginning stages of gathering information from all Maryland nurseries that are level 2 or higher, with particular interest in where NICU moms have access to loaner pumps, no out-of-pocket costs, versus renting. Access to rental pumps, resources, and costs if no loaner pump program exists, and how community resources such as WIC are involved. We are exploring which hospitals use donor milk and who their patient client base is. Breastfeeding speaking engagements. NBC members were featured speakers at the Maryland Coalition of Lactation Consultants meeting. Topics included the amazing science of breastfeeding, providing cultural, humble lactation care, and tongue tie. On the slide that you have in front of you here, on the slide, we have August 13th, building healthy communities at home and abroad. August 17th, the CCI Run Baby Run event. August 20th, breastfeeding family photo shoot. August 25th, the Bloom Collective screen chocolate milk. August 29th, Baltimore Healthy Start Black Breastfeeding Event Collaboration. Mother Hugh DC event, August 31st. August 27th, NBC Screen Chocolate Milk. Over 60 people attended. So you see, NBC had a full week of, of breastfeeding month for 2019. We've come a long way from 2018 to 19, where we have incorporated a lot of events. So in closing, NBC would like to thank you. We salute you, USBC, for planting the seed of change. Our table is expanding and looking different one day at a time. There is room for me and you in the Maryland Breastfeeding Coalition. In summary, our goal is to move from theory of equity to practice of equity. Thank you all very much for your time, and I hope you have a fantastic afternoon.
Wow. Thank you so much, Ray. And Maryland is really just an example of how a coalition can have reach and accomplish objectives beyond the scope of any single organization. Key takeaways for me were just how amazingly you've been in listening mode and has been going to other community, so intentionally reaching out. Promoting equity can't be a passive thing of supporting equity. It really has to be such an intentional, active, everyday practice of looking at how we can change the way we do things. And thank you again, Ray. Before we turn it over to Virginia, but I also wanted to let you know that the chair of Maryland Breastfeeding Coalition, Nancy McAuliffe, is also here as a panelist and will be here to answer any questions with Ray when we make time for Q&A at the end of the presentations. So now it's over to Jareen and Angela, and I'm going to pull up your slides. All right. I wonder if my line was muted or not, but thank you so much, Ray. Did you hear what I just said, or was there silence after Ray ended, Miriam?
We heard you, Kinkini.
Okay, great. Thank you. So over to you, Jareen and Angela.
Thank you so much, Kinkini. I'm Angela Love-Zarenka, and I'm the chair of the Virginia Breastfeeding Coalition, and my co-presenter, Jareen Fleming, is the state breastfeeding coordinator. We'd like to share some examples of how state health departments can collaborate with state coalitions to focus on initiatives which support breastfeeding families. We've had some really helpful new developments in the Commonwealth this year. There's the governor's executive order to extend 8 weeks of paid family leave to state employees. Additionally, all state employees will now have time and an appropriate space to express milk during their work period. On a local level, the city of Richmond is working to become baby-friendly and has implemented a citywide lactation policy for all employees. We've utilized broad brushstrokes to make systems-level change. We started with the hospitals and maternity care centers. Now we are working on worksite recognition program as well as an early care setting. Next slide. As state breastfeeding coalitions around the country know, the first 1,000 days or first 2 years of a child's life play a formative role in that they provide a window of opportunity to positively impact childhood and adulthood health risks, including obesity, hypertension, and diabetes, as risk for each may be programmed by nutritional status during the first days of life. This early postpartum period is an essential time for establishing and supporting breastfeeding. A multifaceted approach is essential. Virginia's plan for well-being lays out the foundation for giving everyone a chance to live a healthy life. This plan highlights specific goals and strategies on which communities can focus so the state can make measurable health improvements. Virginia's plan for well-being is a comprehensive outline to guide the health department and our community partners to work collaboratively to achieve the best health outcomes in Virginia. Next slide. This plan has 4 aims. I think it's safe to say optimal human feeding supports all of these aims. Wouldn't you agree? Next slide. The nice thing is that human milk feeding is specifically included as an important strategy to achieve aim 2, which is a strong start for children to reduce racial health disparities. Next slide. So the Northam administration is actively engaged in advancing equity in maternity care. In June, Governor Northam directed administration leaders in the healthcare and human services community to develop strategies to eliminate the racial disparity in maternal mortality rate in Virginia by 2025. In order to achieve improved outcomes for all populations, it is important to incorporate culturally sensitive training, education, and best practices in the implementation of evidence-based care. The governor has directed the Department of Health Professions, which is the licensing board in Virginia, and the Department of Health to explore ways to increase implicit bias and cultural competency training for healthcare professionals. The racial disparity in human milk feeding has a ripple effect in these families, impacting health outcomes over the lifetime and even into future generations. Jareen?
Jareen, your line might be muted.
I'll go ahead and Jareen will join us as soon as she can figure out her audio issue. So the Virginia Department of Health manages a number of initiatives to promote human milk feeding, which Jareen is integrally involved with all of them. They include the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, the Virginia Breastfeeding Advisory Committee, the Virginia Maternity Care Quality Improvement Collaborative, the Breastfeeding Friendly Maternity Care Awards, the Home Visiting Breastfeeding CQI Project, and the Breastfeeding Friendly Child Care Center Toolkit. Next slide. We've had some wonderful news in August when the USDA published its latest national WIC data. Virginia experienced a 2.1% growth in WIC participants, making us the #1 state in the country for 2019 participation growth. A year ago, we were number 29 at -2%. This is a phenomenal turnaround and a real testament to the Progress Improvement Plan, which was put in place in December of 2018. This strategic blueprint has focused on improving the efficiency and effectiveness of the WIC program using data analytics, mapping, and partnering with external organizations. The goal for the WIC department is to have 120,000 participants by next year. Here are the top 5 states and their 2019 monthly participation figures. Next slide. So we actually have a committee in Virginia called the Virginia Breastfeeding Advisory Committee, and it is a member organization that advises the Virginia Department of Health on best practices in infant feeding. The mission of the VBAC is to improve the health of Virginia families by promoting, protecting, and supporting breastfeeding throughout the Commonwealth. That group initiated the development of the Virginia Maternity Care Quality Improvement Collaborative. Next slide.
Hello, can you hear me now?
There you are. Good job. Good timing.
Thank you, Twin. I really appreciate that. So the advisory committee, so I couldn't hear you while I was trying to dial in. So have you already talked about this slide and the advisory committee? Are we on to the Quality Care
Yes,
Improvement Collaborative. Okay,
this is where we
so
are. Thank you.
thank you. So good afternoon, everyone, and I apologize for that technical snafu. So the collaborative was actually a 5-year project and concluded last year. It was a joint undertaking of Virginia WIC and the VDH Division of Prevention and Health Promotion. It was funded by a CDC 1305 grant, and the collaborative provided technical assistance and education to Virginia's birth facilities regarding quality improvements in maternity care practices. Next slide. In 2015, the public breastfeeding protections in Virginia were strengthened when Code of Virginia 32.1-370 went into effect on July 1st. VDH provides this law card that you see here on the screen to WIC offices, clinics, and birth facilities, and any outreach event that I can make it to be included in the mother discharge package from birth facilities, and primarily to increase awareness about the public breastfeeding law. Essentially, the law was put into place, but there was no funding in place to educate the public about it. So we're really a little retroactive in finding inexpensive ways to get information out. We also established this email address that you see here so that any concerns or questions or violations, if a mother or family's parents' rights have been violated, they can be directed here to the Office of Family Health Services. And then we set out to educate the offending business or facility. Next slide. So the VDH Division of Child and Family Health, in conjunction with the Virginia Breastfeeding Advisory Committee and the Coalition, runs the Virginia Maternity Center Breastfeeding Friendly designation. It's a mouthful, so we commonly refer to it as the 5-star program. This program awards a star for every 2 steps achieved in the 10 steps to successful breastfeeding as defined by the World Health Organization and UNICEF. This program was launched actually when I first arrived here in Virginia, so it's been 3 years now, and thus far 17 hospitals have been recognized, with 8 of them receiving the top rating of 5 stars. Next slide, please. VDH has partnered with the University of Virginia to provide a comprehensive online breastfeeding education program. Breastfeeding Friendly Consortium offers nurse and provider breastfeeding education required to meet Step 2 of the Baby Friendly USA requirements. The Office of Child and Family Health provides the training at no cost to Virginia residents to increase hospital staff knowledge base and to encourage hospitals to adopt baby-friendly standards, and I should say birth facilities. Next slide, please. And that BF consortium is available to anyone. I encourage you to take a look at the learning modules there. Finally, and well, not finally, but also within the health department, our home visiting programs and the maternal, infant, and early childhood home visiting expansion grant. You may hear it in the community called MECHIV or MECV. This collaborative strives to inculcate best practices for breastfeeding support in the home visiting arena. So the home visiting programs participating in the continuous quality improvement learning community fulfill a vital role. The care coordination services provided by home visiting programs ensures client access to necessary services and provides the home visitor with a unique opportunity to provide one-on-one and family education. The individualized wraparound philosophy of care provided in home visiting builds constructive relationships that are uniquely situated to help bring about behavioral changes. So it's been my goal to put more or get more lactation expertise, basic breastfeeding management into that population because they're already in the homes, they're already with the families and building relationships with those families. So the Division of Child and Family Health oversees the home visiting programs and administered that grant. So 18 funded sites in Virginia went through a continuous quality improvement learning community to improve the breastfeeding initiation and duration rates among families receiving home visiting support. Next slide, please. And advance once more. So the Breastfeeding Friendly Childcare Center Toolkit has been available for some time in Virginia. It's on our website for free. It's a resource to help early care centers adopt best practices to support breastfeeding families. And the toolkit can be ordered on the website that you see there on your screen. So as I said, that has been around for some time. And when we actually launched our new recognition program, because this has been out and circulating and being put into use in the community, there were many child care centers that were early care providers that were ready and primed to apply for the recognition program. And back to you, Angela.
Thanks, Jareen. So next slide. The last and most recent breastfeeding initiative is the Virginia Breastfeeding Friendly Recognition Program. To recognize the programs that exhibit best practice and lactation support, this summer, the Virginia Department of Health, in partnership with the Breastfeeding Coalition, the Child Care Aware of Virginia, and Virginia Early Childhood Foundation piloted the awards program. The recognition highlights workplaces and early care and education settings that have created spaces and made institutional and cultural changes to allow families to continue human milk feeding for as long as they desire. The early care organizations, which are recognized, received a rocking chair, nursing pillow, and other technical assistance to provide a comfortable space for nursing parents to breastfeed or pump at the center. The awardees also received a plaque and door clings for their place of business. And you can see here in the picture that actually is the proclamation that had August as Breastfeeding Month in Virginia. Next slide. We recognize the benefits of breastfeeding and providing human milk to infants and young children for as long as a family desires. Since nearly 2/3 of Virginia's young children have working parents, we know that it's crucial to have breastfeeding support in early care settings. This program provides education, technical assistance, and tools for early care providers to support breastfeeding families. Even with a soft launch, we've received over 25 applications so far. Next slide. Now, the Workplace Awards are bronze, silver, and gold, and determined by an evaluation which takes into consideration the size of the company and the level of lactation accommodations provided. The project was funded through a Preventive Health and Health Services Block Grant. This first pilot year, we had a goal of recognizing 10 worksite awards, and we surpassed that objective and awarded 23. Our plan is to continue to grow this collaboration and promote the program with chambers of commerce and early care educational forums. We are confident that the focus on the Worksite Recognition Program can encourage the Small Business Administration to support future legislation to provide reasonable break time and accommodations to all lactating parents. In the previous year, there was actually a bill that was defeated. And so our hope is that the coordination with the various work sites will allow for more support from individual organizations and individual companies in Virginia to support this legislation. Next slide. We released the application on June the 1st, and we held the awards ceremony on September the 6th. A very lovely affair. Next slide. So we accepted applications through SurveyMonkey. They were categorized, as I mentioned, by company size and the number of supportive measures they provide. And some of the supportive measures include whether or not they have a breastfeeding policy, if they allow babies to accompany the nursing parent to work, and a comfortable place to pump or to nurse their babies. And as you can see, a lot of people came to the awards ceremony and were very proud of the recognition. Next slide. So here's a list of our Silver Workplace Award recipients. And on the next slide are the Gold Award winners. And you may notice both small businesses, large corporations, and even healthcare systems who applied for the award and actually received recognition. Next slide. So the Virginia Breastfeeding Coalition is undergoing quite a transition at the time, and this is actually our new website, which includes the worksite recipients. We'll also highlight the Early Care Award winners and the Child Care Aware in Virginia Early Care Childhood Foundation awardees. And so we'll have all of these on our website. They are on the website, and our new website is babreastfeedingcoalition.org. Next slide. So the coalition is rebranding, and we have a new website which aligns with USBC objectives. We're so grateful for all of the resources that USBC has on the website and all the technical assistance that they have provided to us. Our emerging challenges include wanting to increase our community engagement, and we are evolving from a heavily professional membership to one which will better reflect the communities in which we serve. We provided 4 scholarships, and 2 first-time attendees went to the USBC meeting this year, the convening this year in Maryland. And the Virginia delegates were very inspired by the experience, and they have returned to Virginia with lots of ideas and the beginnings of an action plan to bring more people to the table. We are empowered by the tools from USBC and the people who are engaged in this community, and will create the change we want to see in Virginia. We are very grateful as well for our relationship with the Virginia Department of Health, and we have received a grant in the coming fiscal year to perform a breastfeeding support, strengths, and needs assessment in the Commonwealth. Next slide, and Jareen.
Thank you, Angela. So in closing, we believe the combined efforts of the breastfeeding initiatives that we've reviewed today will help Virginia become the healthiest state in the nation. We know that there are many, many factors that impact families, and so we've had to take a multifaceted approach so that we make sure that we're not leaving any people standing in the gap, that we're educating from before birth, the birth facilities to adopt better practices. We know that most families return to work very shortly after the home stay period with babies. So getting the workplaces on board, getting the child care centers on board, and then working to normalize breastfeeding in Virginia. This is actually a PSA or advertisement that we've been able to put in the airport in Virginia during World Breastfeeding Awareness Month. Women want to breastfeed and families want to bond with their thriving babies. So by providing the same supports and access to all families, we can achieve this goal. Thank you so much for giving us this opportunity to share what's happening in the Commonwealth.
Oh, fantastic, Angela and Jareen. And again, such a clear, compelling example of partnerships, and Virginia specifically showing that when the Department of Health and the coalition work together, that you can have change across so many systems, from WIC to McWee to the Breastfeeding Advisory Committee to the Quality Maternity Care Quality Improvement Collaborative, just a spectrum, the home visiting, the child care. So yes, please visit the new website. And is the toolkit, breastfeeding friendly toolkit, available for download there? I know we'll have Q&A later, but I just wanted to make sure that
let me check on that. Let me check on that. While we're actually, as I said, that particular tool has been in existence for some time, and one of the objectives of our work group with the new award system is actually to update it and revise it. I think it's still a good and useful tool, and that's one of the things that the new tool. This is actually a book, as a hard copy. The new tool will be available for downloading, but this one currently is not. And Kenny, if you would just advance the slide once more so that Angela and our email addresses will pop up there. And I welcome any follow-up questions via email. I know I'm a person that has to mull over new ideas, and so I might have a question tomorrow, and you're welcome to email me directly if you have something that we don't address during the Q&A today.
Wonderful.
Thank you.
Thank you again, Angela and Jareen, for this terrific presentation. And now I'm going to invite DC Coalition. So welcome Vanessa Hannibal and Dr. Jennifer Tender. So I am going to open your slides in a second. All right, you're set. Welcome.
Thank you. Hello, I'm Vanessa. Jenny and I are going to be speaking from the DC Breastfeeding Coalition. We'll be talking about how we're advancing inclusive and equitable breastfeeding support. Next slide. Our objectives are that we hope that you will be able to describe one way the DC Coalition is improving access to breastfeeding support in communities of greatest need, be able to list one way the coalition is improving diversity in the lactation field, and that you would be able to identify how the DC Coalition is optimizing collaboration and accountability for system level change. Jenny and I just want to state that we don't have anything to disclose. You can advance the slide. With DC, so our population is about 700,000 residents, and as you can see from the slide, our city is divided into about 8 wards. Excuse me. If you look at the picture, you'll note that wards 7 and 8 are divided from the rest of the city by the Anacostia River, and that's considered the southeastern side of the city or east of the river. In the southeastern portion of the city, you find the largest health and economic disparities, with wards 5, 7, and 8 having more than 90% of the residents being African American. Next slide. This picture is from the Healthy People 2020, and what we just wanted to highlight is that when you look at the targets for breastfeeding initiation and duration, DC is at or exceeding in every target area. Next slide. But as we look and we kind of break things down by race, what we see is that there is significant disparity amongst Caucasian versus African American women. And for initiation and duration, at some levels, it's almost 3 times higher for Caucasian women than it is for African American women. Next slide. So when you look at the 2 previous slides, you see that there is significant need. So the coalition was established to be able to reduce the disparities, especially for our families who are most vulnerable. Next slide. In 2003, just a little history about our coalition, the DC Breastfeeding Task Force was established. And from that task force, the goal basically was to assist with a national breastfeeding awareness campaign. And as you'll see in a further slide, a goal was to create a resource guide. After the task force was convened, about a year later, the coalition was established. It has maintained a membership of roughly 30 to 45 members from various disciplines. Next slide. One of the ways that the DC Coalition is improving access to care is that we have our East of the River Lactation Support Center, which is located in Ward 8, one of the areas of significant need that was mentioned earlier. The East of the River Support Center is a collaboration between Children's National Health System, WIC, and the DC Coalition. Next slide. In the East of the River Lactation Support Center, what you will find is that primary pediatric care is integrated into the center and it's open to anyone in the community. So within the East of the River site, lactation peer educators provide primary support, and then they are supervised there by an IBCLC. There's also a breastfeeding medicine physician who is available for consults. Parents who attend or receive services at the center, they have access to prenatal breastfeeding education, postpartum breastfeeding consults. We have a Mom's Got Milk group, which is open to the entire family. And then they also have access to the Pacify app. I'm not sure if you all are familiar, but it's an app that allows them to video chat with a lactation consultant 24 hours a day, and it's free of charge to them. And we also provide referrals for any families who need additional assistance or have greater needs than what they can receive there at the center. In the 2017 fiscal year, we served 844 families. 90% of them received Medicaid. Next slide. This is just a flyer that we hand out for people to know what services are available for them at the East of the River Lactation Support Center. Next slide. As I stated before, our peer educators staff our East of the River lactation site, and we also have them on staff at Howard University on the postpartum side. Our peer educators provide prenatal education and support East of the River in the DC public school systems. They provide prenatal education for teen parents, and also within the Howard University on the obstetric clinic. And one of the benefits of going to the East of the River site and other sites is that they have access to WIC, and they can get assistance with having WIC appointments scheduled as well. Next slide. As I stated earlier, in 2003, when the DC Breastfeeding Task Force was convened, one of their goals was to create a resource guide. So in 2004, we were able to distribute the first resource guide, and it is currently updated every 2 years. It is now available in 3 languages, Spanish, English, and Amharic. At the beginning of 2019, ASHTO granted us funding to be able to create the resource guide as an app, and thus far there have been over 2,200 downloads. Next slide. Another way that we're improving diversity is that the DC Breastfeeding Coalition offers a certification prep course. We've been offering the course, since 2015. And it was created to address the low level of IBCLCs within the district. And the goal is also to increase underrepresented IBCLCs in the city. So it's a low-cost training where participants are able to receive 45 hours of lactation education, which is half of the 90 that participants would need to sit for the IBCLC exam. Thus far, in the 5 years since the course was created, there have been 55 participants. I was one of those participants this year in 2019. And now the coalition has created a lactation certification scholarship. So that scholarship in the near future will be able to provide funds for people who are from underrepresented groups who need assistance with funding for the IBCLE exam. Next slide. So Jenny will take over from here.
All right, great, thank you. So the DC Breastfeeding Coalition has collaborated with organizations for system level change, and we've worked closely with the DC Council and consulted on the Infant and Toddler Development Health Services Act, which is now called Birth to 3 for All DC. And there are 2 sections of this act related to breastfeeding. The first is to provide support to underrepresented people to complete the academic requirements to become an IBCLC. And the second is to provide lactation support in primary care sites. We also consulted on the Baby Friendly Hospital Initiative of 2018, which mandated that all birthing facilities become baby friendly by 2025. And unfortunately, this bill did not go to full committee, in part because 2 hospitals expressed concern about it. And since then, 1 hospital has agreed to pursue certification as baby friendly, and we plan to encourage the council to reintroduce the bill. We provided testimony on the acts above and also on the Child's Right to Nurse Act of 2007, which allows a person to breastfeed anywhere they're allowed to be. and also ensures that employers provide space and time to breastfeed. On the Universal Paid Leave Act, which allows up to 8 weeks of paid parental leave starting in July 2020, and defending women's access to health care, which ensures ongoing payment for lactation support and equipment if the Affordable Care Act is repealed, as well as the Breast Milk Bank and Lactation Support Act of 2014. So all of these bills did pass. If you could do the next slide. So although the Breast Milk Bank and Lactation Support Act of 2014 did pass, it was not funded. One of the components of the bill was to create a lactation commission, and we pushed the DC Council to establish this commission even though the rest of the bill wasn't funded. The Lactation Commission was established in 2017. The Department of Health, we call it DC Health, oversees the commission, and there are multiple government organizations represented on the commission. The commission's goal is to promote and support breastfeeding in DC. So some of the recommendations that from the commission include making sure that lactation advocates are included in future mayoral summits about perinatal health. So this recommendation was developed after the mayor held an inaugural maternal and infant health summit, but didn't include any breastfeeding topics. So another summit was held just last week, and Dr. Sahara Long was invited to speak about breastfeeding. We also recommended that DC Health determine if a milk bank is needed in DC, and if so, the best options for operating it. We asked that DC Health commissions fiscal impacts report for a needs assessment to determine what lactation services are needed in DC, and a needs assessment to determine whether or not we need a district-wide hotline or a telelactation app. And we also want to make sure that DC Health initiates a program to implement breastfeeding-friendly practices in federally qualified health centers. Next slide. So the DC Breastfeeding Coalition worked closely with the Department of Healthcare Finance, and they oversee Medicaid managed care organizations, and to help create a policy to promote breastfeeding. And this policy basically created a rule to allow lactation consultants who are not dual certified, so someone that just has an IBCLC degree alone and is not an IBCLC and a nurse, for example, to become Medicaid providers and be able to bill. And we hope to maybe expand this to CLCs in the future. It also required that Medicaid cover breast pumps and lactation supplies. Unfortunately, their reimbursement rate was so low that no durable medical equipment company would distribute the pumps. So we then worked with the DME companies to have them negotiate with Medicaid managed care organizations to come up with more acceptable rates. And we are now distributing breast pumps in many outpatient clinics. We have also the outpatient coverage of donated human milk. So our next steps are to continue looking for funding to support our projects. And we hope to work with DC Health and the Lactation Commission to conduct a community needs assessment, implement a breastfeeding curriculum for K through grade 12, create an online breastfeeding library, and improve community support with more breastfeeding peer educators. We want to continue working on the breastfeeding provisions in the 0 to 3 bill, and we are also looking to offer prenatal breastfeeding classes in partnership with Gallaudet to the deaf community, and exploring making the resource guide app more interactive and available in both Spanish and Amharic. So our advice to, our advice to organizations, well, first of all, is to find a great leader. So I'm going to just do a quick shout out to Dr. Long, who's been our leader since its inception. And under her leadership, I mean, she's just brilliant. She's innovative. She gets things done. But unfortunately, she can't be cloned. So the other things you can do are to identify communities with the greatest need for breastfeeding support. So you can focus your energies there. And we realized early on from both experience working in the communities and an evaluation of birthing facilities in DC that the East End of DC had the greatest need. Identify breastfeeding advocates in the local government and the Department of Health who you can collaborate with to create legislation and mandate changes, and advocate for legislation that supports breastfeeding. Provide support to birthing facilities to help them become baby friendly. We have been providing support, technical support to birthing facilities, and now we have 2 baby friendly hospitals and 3 are on the path to becoming baby friendly. And finally, engage traditional and non-traditional partners. For example, we've been working with schools, businesses, WIC, legislators, and the health department. And that is it from our, I think you just have a picture of our coalition at the end there, but yep, there we are.
Fantastic. Wonderful, Jennifer and Vanessa. And again, just a testament to when your mission is so explicit. For DC Breastfeeding Coalition was established to reduce breastfeeding disparities among the most vulnerable families in the community. When you have that as your mission, just the spectrum of work that has been done to optimize the collaboration, improve access, lift up the entire spectrum of lactation support providers, and be such a resource to the community. So thank you again to our wonderful panelists for the terrific presentations today. Just shows you that when you leverage the expertise and the passion and the wisdom and the talents of your members, and you have good leaders instead, and you really partner with communities in meaningful ways, how much can be accomplished. So we are open for questions. Yes, there's a question which says, where can we get the slides for these presentations? And yes, usually we give a direct link in the chat box to the presentation, but this time, because we have 3 slide sets and the file size was too large, Miriam has posted the link to the Power Tools webinar page. And if you go to that page, you just scroll down and you'll see the write-up for today's webinar and the link for the slides as well. Okay, we have IBCLC's, okay, let me see. What kind of CDC grant? Let me just read this. We have a lot of questions coming in. So I think this was Ruth Piatak from Oklahoma asking what kind of CDC grant was that to the 1307 grant, 1305 grant that that Marilyn mentioned. Ray, would you be able to tell us a little bit about the CDC grant?
I think
that was Virginia. Sorry,
it was yeah. That was yeah, and it's
yeah.
It's a 1305, and that is through the the health department is divided into offices, and we are all in the same division of family health services. But the 1305 grant actually was applied for and administered through the Division of Prevention and Health Promotion. So that was a 5-year period.
And so there were many elements in it, and breastfeeding was one of the breastfeeding
that is correct.
Was included in the broader public health agenda of that grant, right?
Yes, that's correct.
Wonderful, and that's so critical to be able to get breastfeeding on chronic disease prevention, childhood obesity, all of the different elements of public health, to be able to get the resources and the funding to be able to do that. Wonderful. One question for Virginia was, what was the difference between the gold and silver levels in your workplace awards?
So
well,
the difference had to do,
you want to take that, Angela? Okay, great.
Yeah, so the difference had to do with the size of the organization. For example, some of the smaller organizations couldn't allow some of the things that the larger organizations could, and vice versa. So some of the larger organizations could offer a pumping and nursing room in different locations throughout their facility. And some of these facilities are huge facilities. So, we didn't want to say that an organization which didn't have that capacity didn't receive the recognition. So we scaled it according to size of the organization.
All right, thank you. This question is for each one, all of the three, both of the states and DC. Lorena's, how does your coalition support some of the, local coalitions in this inclusive and equitable way? Like, what has been some of that magic sauce that Maryland is using and you all are using in outreach and listening? Virginia, do you want to talk about your state coalition support, or Nancy or Ray want to talk about Maryland?
Could you rephrase the question?
Yeah, how is the state coalition kind of being in this listening mode and supporting the local coalitions, supporting local communities, making the connections with local communities in these inclusive ways?
This is Nancy from Maryland. Can you hear me, Kenny?
Yes, I can, Nancy. Go ahead.
Okay, great. As far as that question goes in Maryland, it is a lot of looking around the state and finding out what's going on, and it just kind of snowballs from there. And so sometimes I joke in our coalition meetings that I'm a little bit of a Facebook stalker. I'll find something that's going on and then things kind of connect from there. So just intentionally looking at the entire state and finding out what's going on, and then actually just showing up and listening to what's happening and hearing what the needs are and seeing how we as a coalition can support and lift up that great work.
Thank you, Nancy.
Well, and this is Angela from Virginia. So one thing I wanted to mention is how we are looking to the USBC resources. And a few years ago at one of the convenings, North Carolina discussed their flipped classroom. And so that has inspired me to want to do the same. So similar to what Maryland is doing in Virginia as well. Virginia is a very large state, square mileage. And so that's why, going to those areas to listen, to show up is of vital importance. And so my point is that there are resources there. There's a roadmap there. So it's not like you have to necessarily make it up, which is fantastic. So thanks to USBC.
Well, we are constantly learning from you all, and you could go through, if you go and listen to the recording again, go down Ray's list of all of the things that Maryland is doing, going to other community meetings, prioritizing outreach, Black Nurses Association, faith-based, doulas, and similarly with Virginia and DC, the community aspect is such a strong portion of this. And I know, DC, that although the question was how can state coalitions support local coalitions or local communities in this, local community organizations in this inclusive and equitable support, could you share a little bit of how much some of those partnerships for DC Coalition have meant?
I'm not 100% with that what you're asking, but what I can tell you is that a couple of things. First of all, DC is very small, so we only have one coalition, and we don't necessarily go out and support other coalitions. But just as far as working within local communities, one of the things the Lactation Commission is interested in doing is doing a needs assessment to really understand what's happening in our communities. We do have active members in our coalition who are peer counselors, who are coming from the community and giving us that perspective. And also a lot of the healthcare providers are working in community sites. There's a lot of we hold our meetings in the east end of DC, where a lot of the coalition board members are working directly with patients with the lowest economic, I guess, low economic families, and getting perspective and seeing what's happening directly from them.
Right. No, thank you, Jennifer. There's a question here for Jennifer, which is, how is the resource app updated? Like, is there an option for users to update it? If so, how well does that work? And it could be Vanessa or Jennifer, any of you.
We have Dr. Long on the phone, so I'm going to have her answer that.
I can answer that.
Yeah,
I can answer that question.
Yeah, go ahead.
So due to funding limitations, the first version of the app that we released was a static version. So it's essentially a walkover of our paper resource guide into a downloadable app. So it's not very interactive. It doesn't allow at this point any user feedback or uploads or anything like that. We're actually looking in this next year to see if that's something we can change. So we'd love to include all of our locations that have won the Breastfeeding Friendly Awards for both healthcare providers and workplaces with our awards that we do with Maryland, so that a person can enter where they are and then find the places that are close to them. We also want to allow folks to suggest breastfeeding friendly locations that they've been, so that the whole community learns from each other. Again, that costs money, so we're hoping to use one of our current grants to try to cover the cost. And if anyone has money they'd like to send our way to make it more user friendly, by all means, please do.
Thank you, Sahira. And add, if you go to Miriam, could you post the URLs for each of the coalition websites, if you could? Check out the resources and sign up if there's a newsletter, sign up if there's anything. Miriam and I sign up for pretty much every state or local coalition that has a newsletter, and we are just amazed at the innovations, the partnerships that are happening. And USBC, it's really bi-directional. As much as we love our work in partnering with you and providing capacity building support, we learn so much from our folks, partners on the ground. So really, you don't have to invent the wheel. Check out what other coalitions are doing, go to their website, sign up for their newsletters, and know when there's trainings happening or free webinars or a new resource that's going up. So we hope that that's a great way to stay connected and use your very precious resources. No coalition is ever swimming in money, so you have to use your resources in such strategic ways. If you can get help from other coalitions, other states, other communities, other territories, that would be great. And then USBC is also a resource. We are very, very excited to be launching a whole new page on coalition capacity building very soon. It's all about how to build a coalition, how to build your membership base, how to work on your board governance, how to work on conflict, how to work, advance equity. So we've curated and collected the best things that we have from the field, from our partners, things that we've developed as well, and we can't wait to show it to you in a week or two. Let's see. A lot of comments about how excellent this session has been. Again, thank you so much to Ray and Nancy from Maryland, to Jareen and Angela from Virginia, and to Jennifer and Vanessa from Maryland, and Sahira, of course. Amazing work from your coalition, so much that we can learn from. So thanks again. We are now going to turn it over for some USBC updates, and I'm going to invite Camille Abbey, our Events and Public Relations Manager, to share some info and action opportunities for us to learn, connect, and act together.
Thanks so much, Kinkini. Thank you, everyone. It was amazing to hear about all of this work that is happening so fast and so just in so many places. It's really amazing. So thank you so much for sharing. So just a couple of updates from here, from USBC world, if you will, which is all of our world. So September is National Preparedness Month. If you haven't already seen, we do have monthly observances page on the website, which I can show briefly in a moment when we're touring some other things on the USBC site that are new. But we have a variety of resources listed there. Definitely now is hurricane season, so we're definitely keeping our eyes on that and thinking of folks who have been already in harm's way. So also now we have just dipped over, the 15th began Hispanic Heritage Month. So we also have a page on Latinx communities and resources. And we always invite everyone to please share more with us. So, you know, by no means think that these pages are locked. They're always growing and evolving based on input and what we find and what folks share with us. So please definitely share with us via the online form. We've streamlined it. It's actually even simpler. It's a couple quick questions. You give us the link and we are able to move with that. Is our next slide here, Kinkini? Or can I go? Okay, yes. All right, so I think what I'd rather do is take a little tour, if it's okay. Can you pass me ability to show my screen, Kinkini?
Yes, doing that right now.
Awesome.
Are you showing up as USBC, Camille?
I think that's me. Mm-hmm. Okay. I don't know how that happened. Excellent. Thanks so much. All right. Can you see the Breastfeeding Advocacy Headquarters?
Yes.
Perfect. So basically, something that we have been working on is our policy and actions page, which this is the new homepage for it. It's even going to be growing and changing. You'll see our group here from Advocacy Day most recently when we were on the Hill this year. But what we really wanted to do is make it a little bit simpler for everyone to engage with kind of what's going on right now, what are the active bills and legislation, and what can we engage with. So I'm just going to take a brief tour. We have a take action page, right? So this page is the 3 bills that we have right now, action tools out there. So they're really simple. You literally just click here and it takes you right over to an engaging tool, popping your messages over to your members of Congress. So, you know, it's really handy and we encourage folks to use it. We are hoping to get a few more messages of support, particularly for the Mamas Act, as well as in support of breastfeeding funding, because that's happening right now. So we want to make sure that we are getting our voices out there. So that's one thing we like to do, and invite you all to engage with. Please. This is a really nice active legislation page. So literally widgets from GovTrack, but look how convenient that they're all in one place, right? So you can check in on the state of things really simply, read bill text, see who's sponsoring, co-sponsoring, just by popping in on this tab. You can also check in, I just showed active legislation, excuse me. You can check in on existing laws, right? So if you were thinking, what is the name of that law again? Just have a quick look, and then of course you'll click here. You can read much more information, but this is a little bit of a more user-friendly mechanism for checking in on what are the current laws, where do we stand. Federal policies and initiatives is a similar page. letters and public comments. I don't want to go through every single page. I do want to make sure that everyone knows about the state breastfeeding reports. I know all of you advocates who have participated in Advocacy Day do, but you can click on your state or territory, download your reports, and you have those to use in your conversations. And then we also created a resources page, which has just a little bit of reminders, you know, some of the information from Advocacy Day, all the policy briefing webinar, the packet materials, they're all still here in this. Now it's a little easier to find them. Breastfeeding Coalition directory, the action directory, of course, the webinar series, all of these amazing webinars are available and it can be downloaded. This page is going to be, I'm sure, growing as well, our resources section. Again, this is under policy and actions. And even just for today, what used to be called webinars as of when we woke up this morning is now called the Learning Collaborative. So now you find all the webinar series under the Learning Collaborative tab. You can also find your way into the conference, which of course also has its own, and the learning community. So just so you know, if you come looking for webinars, you'll find them, of course, and they're under the Learning Collaborative, as again, Kinkini mentioned, we are always learning from each other. Quick pop over to monthly observances. So if you were to glance at that page, you will see each one of these icons represents except for this one, because we need one more to go in the space, but represents one of our pages that we've built right now. We were just talking about Hispanic Heritage Month. So again, you can dip in and see some of this pretty robust, but always welcome to get bigger page of resources. So please, again, feel free to reach out to us, either advocacy at US Breastfeeding or Kinkini, myself, Miriam, any one of us, and we're happy to hear from you and to include additional resources or using the submit form. Kinkini, I think I can pass it back to you.
Wonderful. Thank you so much, Camille, and so much better when you can actually see and get a demo of the website as well. So our communications, our team, membership, coalitions team has been really busy sprucing up, adding content. So we hope you'll come and check out our website again. So again, on behalf of USBC and our partners, there's one more update. And Camille, do you want to share, or I can?
I'm here, Kinkini. This is
Danae.
Wonderful. Our member operations and member relations manager, Danae Schmidt, is here, and I'll invite her to share about the new USBC member sessions.
Sure. So first of all, fabulous presentation today. That was wonderful. USBC has expanded our membership network, if you're not aware, and we are hosting a few virtual informational sessions this month for any organizations that are interested in joining the membership network. We are hosting one tomorrow from 5 to 6 p.m. Eastern, 2 to 3 p.m. PT, and then again on Wednesday, September 25th. If you're interested in learning more about membership, please feel free to register at the link that I've just chatted out, and Miriam has also chatted out. And we'll be happy to answer any questions that you may have about membership to the USBC. And again, wonderful presentation today. And that is all for me. Thanks.
Great. Thank you, Danae. And so I think we are on time, and to our fabulous presenters, thank you for the amazing work that's happening in Virginia, Maryland, and DC. We can learn so much from you. To everyone in the audience, thanks for what you do, and know that USBC would be delighted to spotlight your work as well. So write to us, contact us. We are constantly wanting to spotlight the work that's happening on national, regional, state, city level, county level. So let us know, and please do fill out the evaluation and let us know how we've done, and also download the certificate of attendance that you will get. So on behalf of USBC and our funders, thanks so much, and until next time, goodbye.